Okay, so welcome everyone joining today's workshop, Building Better Care. This is a section 0. We will use this opportunity to give everybody who is interested in the workshop a brief idea what is this about. And then of course we will learn something about dementia. And we have a very expert, in the field. Sheila from Alzheimer's Association is going to share some basic information. And I know Sheila, Alzheimer's Association has a lot of workshops on the topic, and I'm sure down the way, we will have a lot of opportunity to work together. Sounds good. And so today, welcome everyone, and I'm sure someone is coming in. So we'll give them some time while I will take 2 minutes to show this video, telling you what CCACC Health is, what we did in the past year, so you will have a overall picture of what we are doing. So welcome everyone, sit tight, grab a cup of tea. Do it again. Okay, thank you so much. And we'll see Sheila's name in one of the long waiting lists in this year. So yeah, so we are actually very doing a lot of the things, and 2021, 2020 has been amazing years, although we have a lot of challenges, but we actually grow a lot. Going back to today, we are going to have the BBC workshops section 0. And Xiaoying, it's going to tell you something about the workshop, and then we will give you a little bit local resource, list of local resource to take care of dementia senior. And then we will have the honor to have Sheila from Alzheimer's Association to give us a brief talk on understanding Alzheimer's and dementia. And then we will have some room for Q&A. And after that, Xiaoying will very briefly to tell you how are we going to do this Building Better Care workshop. And so we are very grateful that we, at the beginning when we first promote this program, for a long time, we don't have any names sign up, but all of a sudden we have 37, and we can actually accommodate so many. But don't worry, we are planning for another session later in the summer. So if we cannot fit you in this time, we certainly will accommodate everybody next time. Okay. So as you can see in the past, in the little video we make, summarize what we did. Little background, CCACC Health Center is actually part of CCACC Chinese Culture and Community Service Center. And we are a safety net clinic. So we are a nonprofit and a safety net clinic based on in Gaithersburg, Maryland. And like I said, we are a safety net clinic, meaning we provide medical care and health-related care, including like mental health, social service, to just make sure people in the community have access to the health resource to keep them healthy and well. So other than so people, I mean, in this 2 years, when you didn't know about us before, maybe people would know us from our vaccine clinic, COVID vaccine clinic and COVID service. But actually we are starting from a medical provider for primary care and specialty care. And actually we have mental health service. So that's actually our real job. But people know us better now because of the vaccine outreach we do. And we also do a lot of health education and health program that is really address the health of Asian American. So we have special program tailored to that. Okay, so we are going to have this. This is the first time we offer this, and we actually are missing the logo for Living Well Center because this is a program. They got the license, and we are part of that. That's the service they provided. So it's very new. So if you've been following us, you know that we provide a chronic disease management program partner with AICS. So we always have the honor, have great working relationship with AICS, Asian Inter-Community Service Center.
Asian Indian Community Service, and we also like to be called Asian American Inter-Community Service, because you know we are all Americans first. Yes,
thank you. Yeah, so so we work very close together and have all these wonderful workshops, all routine in the Stanford chronic disease self-management workshops. So this one is also one of the branch coming out of that one. And we will have, Xiaoying will talk more about how this workshop goes. But basically, we will meet every Thursday afternoon from 2:30 to from 3 to 5 in the 3 to 5 p.m. Eastern time, and we will talk about different things. And hopefully, we can support each other going through the caregiving process. And I'm actually, Xiaoying and I were trained to host to run that program, and we have a lot of. I myself have a lot of personal experience to share with you because I do have a mother who is suffer from that condition.
Okay. So thank you, Kay. Thank you, everybody. So is okay my voice? Okay.
Yes, very good.
Okay. So thank you everyone to join this workshop. And this workshop is called Building Better Caregivers. So it means it's for the caregivers. And And this workshop is for caregivers who can learn the new strategies. And also the main purpose is to reduce the stress and help you as a caregiver, you can stay healthy. So this workshop has 7 sections, including today. So total will be 6 classes. We will meet once a week for between 2 to 2.5 hours. And every week you will learn different strategies, like a challenge, like knowing the caregiving challenges, and also how to self-care and how to use the different tools to making decisions, by helping to how to communicate with your care partner, with a healthcare provider, or communicate with other family members, and so on. So this workshop is an evidence-based. It comes from the Stanford University, and they developed this program as a foundation. I think in the beginning is the self-disease, self-management program. And then as the time goes by, they find out the workshop, this program really helps the people, really helps the participants. They can develop their own strategy and facing the challenges in their daily life. So they expand this foundation to the different topics like chronic pain and like cancer, and also like taking care of like a memory or dementia patients. So that's why this BBC workshop comes from. Yes. And I think why we want to provide the BBC, and I'm surprised, but not very surprised. We got a lot of interest and feedback from our community, because I think this is the first time we offer this caregiver workshop. And it's we see the needs in our community, especially the past 2 years during the pandemic. And a lot of patients or your parents or dementia loved ones, they need to stay at home. And also caregivers also stay at home or work from home. So you and your care partner stay together all the time. And it's a stressful daily life happens every day. So the BBC workshop, why this workshop works, and because we know the caregivers, most of you have similar concerns and problems. And you are dealing not only the caregiver partners, their issue, and also you need to face, you have other life challenges. You may have your children, you may have your job. And so how we can handle ourselves to do the multiple tasks, that's a challenge. So this workshop is like evaluated from a research project, and the evidence base, it shows it really helps people and to learn the strategies and improve improve their caregiving strategy. And also you can also improve your loved one, your care partner's overall health. So it's like win-win situation. Yeah, so I really excited and looking forward to have you guys to join this workshop. Okay. Yes, and this is an overview about what we're gonna learn in the next 6 weeks. So including the thoughtful breathing, like how to release your stress, and also learn some action plan strategies, like making decision or problem solving skills, and see if you have some issues happens in your life, how we can resolve the problem. And more is like help or getting help or medication or relaxation. So that's a whole overview. So I will give this sheet before the first class. Okay. And these are community resources might be helpful to as a caregiver to everybody. If you have your dementia or Alzheimer family members. So you can go to the website, including, I will send an email to list links to everybody today. So you can, if you need if you're looking for some resource, the Alzheimer Association is a very helpful website. They have a lot of very helpful information. And also I know it's a nationwide organization. I think Sheila will talk us more later, yes, about how to help our caregivers find the right resources. And also in Maryland, the Maryland Elder Department, they have the access point. So there's also like official website. They try to connect all the resources in locals, and then you can find what like a long-term care program or government program or Medicaid program can help your family members. And the caregiver programs is run by Living Well Center in Maryland. So like this workshop is called Building Better Caregivers. And they also have other caregiver workshop programs. And you can go to the Living Well program. They will announce the more workshop schedules, and then you can find some resources or the date you fit in so you can register. And also as CCACC, like us, we provide so many different health services in the community. So if you're interested, you can also check our website. And the other one is MHAMD is a mental health resources. And they also have some useful information. I will send a link to everybody. Now, yes, now I don't want to spend too much time. I want to leave more time to Sheila to tell us more about what's Alzheimer and dementia. Yes, thank you, Sheila. Yeah, so I will stop sharing and then just
Thank you so much. It's wonderful to be here, everyone. I just learned so much. I put so much have so many notes that I took for myself from your slides, ladies. So thank you so much. Thank you for inviting me today and actually having this type of workshop for your community and our community at large. This is so necessary. And everything you said about caregivers, you're going to see today, I'm going to talk about actual numbers of people with this disease and I really focus on the US, but we know it's a worldwide disease. But, you know, we have to start focusing on our caregivers, and we have to start focusing on research for a cure. And those are, you know, obviously, you know, that's the Alzheimer's Association's mission, and you'll find that out now. So hopefully everybody can see my screen.
Yes.
I'm going to go ahead. I'll minimize our pictures on my screen so then you can see more. And let's talk about understanding Alzheimer's and dementia. And so today I'm going to go through the program. It's a little bit of an abbreviated program because we want to fit into an hour. But this program and all of the materials you see today, you can find on my website, on our website, Alzheimer's Association. But I'm happy to go ahead and send the slides so that they can be sent out by email if you'd like. So people usually ask that, can I get the slides? And so definitely you can get these slides. So we're really going to look and understand and compare Alzheimer's and dementia more than anything today. That's the biggest thing you'll get out of this, this webinar. But a lot of people know it's a brain disease, but don't know how it really affects the brain, how Alzheimer's affects the brain. And we're going to talk about risk factors and the stages of the disease. And then we have some of our current FDA approved treatments, and then also some of our other information. We said earlier that I have a lot of resources too. So I'm glad that you guys, that your community considers us a resource, because we really are to everyone. So I'll go ahead and show you more information about the Alzheimer's Association in that way. So as I said, I'm going to do like an abbreviated program today. So if I skip a few, I'm just trying to keep our time together. So first of all, we always start out with a little bit of a quiz question to see, just test your own knowledge and see what you really know about Alzheimer's disease and dementia and the differences in the two. But first off, let's talk about how many Americans, so people in the US, are currently living with Alzheimer's disease. And the choices are 850,000, 5.8 million, 12 million, or 3.4 million. And usually when I'm in person, I make everybody raise their hand and what's the right answer, but I've found virtually it's better for me to just click on the right answer and then we can see it. Don't have to make you all guess. But
Thank
believe
God
it or
it's
not.
about 12 million.
Yeah. Well, that's true. It's only 5.8 compared to the 12, but look at by the year 2050, so mid-century, we'll have 14 million people with this disease. So it's projected to rise that much. So 5.8 million right now in the US, and in mid-century 2050, it's going to be even more, 14 million. So Good news that it's not there now, but bad news that, that it's just rising, unfortunately, for us. So talking about caregivers today really that's our underlying subject of everything, or always my underlying subject is what am I doing for these caregivers and how can I help caregivers? So let's ask a question about them. How many unpaid Alzheimer's disease caregivers are there in the US? So these are people that are not professionals. They're not in nursing homes. They're not in assisted living. They're what we were just saying earlier, that you're in your home, you're very isolated with a pandemic. It's you, the adult child, the adult daughter, the adult son, the spouse, the partner. We're all caring for our loved ones in our homes, in their homes or our homes with Alzheimer's disease. So how many unpaid caregivers does it take to take care of those 5.8 million people who have it? And again, I'll say it's 1.2 million, 8.5 million, 13 million, but this time it's 16.2 million is actually the right answer, believe it or not.
Wow.
People always say, why is it so many more? So there's 5.8 million people with it. So why is it 16.2 million to take care of 5.8 million? And the answer is yes, and 24-hour care. In a lot of ways. So we're going to learn about the early stages of the disease in a few minutes. Maybe we don't need to give so much care, right? It's kind of just normal life to a large extent. When somebody is getting Alzheimer's disease and they're in the middle stages or the late stages, you need somebody 24 hours a day sometimes. So that can really, that adds up to the 16 million people to care. So it's a lot of caregivers. I'm going to skip a few things just to save our time. Here we go, because that's like an Alzheimer's Association thing. So now we're going to talk about Alzheimer's and dementia. And this is the kind of the things that it's good to test your knowledge to make sure we really know what are the differences between Alzheimer's and dementia. So the first one we have is a true-false question. And it is Alzheimer's disease is a normal part of the aging process, true or false? So everybody gets it. Is that true? False.
Yeah, I got that.
Well, good news, false. Not everybody gets it. It's not normal. It's not a normal part of aging. It's a brain disease that causes problems with memory, thinking, and behavior, and is definitely not a part of normal aging. And I always say to people, you probably know people who are in their 90s who don't have Alzheimer's disease, whose memory is very good. Now that's a normal part. That's a normal brain that's aging. Now here's another question. How about, is it true or false? People younger than 65, can they get Alzheimer's disease?
Yes.
Yep, it's true. So approximately out of our 5.8 million people in the US who have Alzheimer's disease, about 200,000 under the age of 65 have what is called younger onset Alzheimer's. And, unfortunately, some people can develop the disease as early as you can see in their 40s or their 50s. So that is just, so much worse than if we're, an older person who maybe is retired and our children are grown. It's harder when our children are younger and we're still trying to work maybe. So we're going to see a quick video. We have a bunch of videos in here and I'm going to skip around, as I said, but this is a good one.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
So that kind of gives you a really good idea of what is the difference between Alzheimer's disease and dementia. And so dementia is that umbrella term, and it's a general term for a collection of symptoms. It's not an actual disease in itself. In that case, it's leading up to maybe one of the diseases that's underneath that umbrella. So Alzheimer's is the most common cause of dementia and has a symptom of dementia. And Alzheimer's, as we said, is not a normal part of aging. It's a progressive brain disease that, you know, hopefully we don't get. We want a normal aging and not have it. So we're going to just learn a little bit about the brain now.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So that kind of gives you a good idea of where Alzheimer's has come from. But we're going to talk about now, what are the risk factors for Alzheimer's disease? And this is another quiz question that is interesting for, I think, people just to test their knowledge. So this question is, what is the greatest known risk factor for Alzheimer's disease? So is it genetics, our family history, or age? And I have to give you an honest hint that all of these answers are correct. So it wants to know the greatest known risk factor. So I'll just say to you that the genetics plays some part, family history could play some part, but age is really the greatest known risk factor. So as we said earlier, only a small number of people usually get this early onset before they're 65. Most people get Alzheimer's as they age. So you can see on this slide, after age 65, the risk of Alzheimer's doubles every 5 years. And that at the age of 85, 32% of people age 85 and older have Alzheimer's disease. So if you think about that statistic a little bit, so 32% 85 and older have Alzheimer's disease, but it also means that 2/3, or around 66%, don't have Alzheimer's. So the majority of the people over 85 do not have Alzheimer's. About 1/3 of them do have it, though, and it's not a normal aging. It's definitely a disease process, unfortunately. So we're going to learn about the stages of Alzheimer's and some of and talking more about the risk factors and then into the stages.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Mm.
So now we're going to this is a very interesting slide talking about, so we've talked about who's more at risk, but what type of populations are more at risk? And you can see on this slide that people of Hispanic origin are about 1.5 times as likely to develop Alzheimer's disease as white people, and African Americans are about twice as likely to develop the disease. And then the last bullet is almost 2/3 of Americans with Alzheimer's disease are women. So people of color and women are at a higher, those populations are at higher risk. People who are Caucasian or Asian American descent, they're at less risk. So it's an interesting, and we don't know why. This is what the research shows, but there's a lot of discussion, and is some definitive but not all definitive answers as to why is it people of color and women who are at higher risk. And we'll hear a little bit more about that as we go. This is just a recap slide. So we know age, kind of as we age, we're getting into the higher riskiness for Alzheimer's disease. Our family history may give us a little higher risk. And certainly there are genes that have given people Alzheimer's disease too, but you can have a parent with Alzheimer's disease and not get it. And you can be 85 years and older and not have Alzheimer's disease. So there's still a lot of research into why certain people get Alzheimer's disease and other people don't. So now we're going to talk a little bit about stages of Alzheimer's disease. So the Alzheimer's Association, we have 3 stages that we categorize everybody in their disease process. But first, I want to play just 2 videos of people who have Alzheimer's disease and how they're talking about living with the symptoms. The first one is this one called A Different Kind of Forgetting.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel, so I've even stopped trying.
And this is a second one called Losing the Words.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
You can see he actually forgot the words as he was making that video. So that's the real hard part about this disease is it strikes us differently. Different people with Alzheimer's disease, it manifests itself differently. And some people it's losing the words. Some people can't do math anymore. Those are some of the first things that start to happen. So we're going to hear from our expert, Dr. Schneider, again, about the stages of Alzheimer's.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
So that was our 3 stages of Alzheimer's disease. The second bullet says it better than I was saying it. No 2 individuals experience the symptoms and progression of Alzheimer's disease in the same way. So it could affect us differently, even though we have the same diagnosis. And while symptoms worsen over time, people progress through the stages at different rates. So you might have known of someone who was in the early stages for a long time, and then there could be somebody else who is in the early stages very quickly, and all of a sudden progress right to the middle stage or maybe to the late stage. So it's unique for each person. And this is coming to the last part of the of our webinar. It's really talking about treatments for the symptoms of Alzheimer's disease. So we're going to take another quiz question, test your knowledge, and this is about it's another true and false about some of our treatments. So there are several drugs available to slow down the progression of Alzheimer's disease. And this, I have to confess again, is another trick question, because there are drugs available for Alzheimer's disease, but this is false, because they don't slow down the disease. They don't stop the disease or slow it in any way. What they do is treat the symptoms. So those dementia symptoms that we talked about earlier, problems with memory, problems with thinking and planning. Sometimes there are some of the drugs that we're going to talk about now help people with these symptoms, and they found that it helps people mostly in the early stages. If they can get on some of these drugs earlier rather than later, it could help their memory be a little bit clearer or their thinking be a little bit clearer. Doesn't cure it, doesn't slow it, but it just helps you as you're moving through the disease as it progresses. So we're going to hear from another expert.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razidine. There's another class of drugs that modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
So there's actually another drug that we have, maybe you've heard about recently within the last 6 months. It's called Aduhelm. And that is another drug that is on the market right now for people with Alzheimer's disease that is not a cure, but can help with the symptoms again. So we just haven't caught up with it on our program yet. But those, if you've worked with people with Alzheimer's disease, in my background is in nursing home care and assisted living, and you've heard of Namenda and Aricept and Razidine, I'm sure a lot, and those are very common drugs, and Namzaric for people to be on. And again, as I said, in the early stages is the best time for a lot of these drugs to see if they can have the best result, and maybe help the person with the symptoms as long as possible, and help them help the symptoms be lessened, but does not stop the progression or cure, unfortunately. I hope one day I'll be back saying, here's the cure, here's the drug for the cure. So the last part is we're just going to talk a little bit about the research that we do, and we'll go ahead and talk about just some of the resources that we have as far as how to get involved with the Alzheimer's Association and use our researches. So just going to play one of these videos.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
And that's what we hope to do. Obviously, it feels like the cure for Alzheimer's disease, and maybe for other diseases too, but it takes a long time, a lot of research, a lot of dollars, unfortunately, to get to the point where we have some better drugs that if they don't cure it, it would be nice to stop the progression or push the progression off really late, especially for somebody who's getting that early onset Alzheimer's disease. If we could eliminate that and push it way off till later in life, boy, that would really benefit a lot of people. So just two things I want to let you know is that there are a lot of clinical studies out there. And the Alzheimer's Association has a part of our website, and I'll show you our website in a moment. It's called Trial Match. If you're somebody who you don't have to have Alzheimer's disease, they actually want healthy people too to study their brains as well. So it's called Trial Match if you'd like to get involved in clinical studies. We can help you do it. And we live in a place where there's a lot of clinical studies and memory clinics and cognitive health clinics here in our area. So we're in a great place for it. So here's our recap that we are getting better knowledge about Alzheimer's disease, especially in the past decade. We hope to see more and more drugs that do better for people with Alzheimer's. And we want to find anybody who would like to take part in any of our studies to please, and it's not specific Alzheimer's disease studies, as I said, they take healthy people also to study their brains. So that's it. We're just going to see how to get in touch with the Alzheimer's Association and our resources. So we have a great helpline, and it's for anybody who has Alzheimer's disease or dementia, or so you could have dementia, have problems with your memory, and really not have a diagnosis yet, just have a diagnosis of dementia, but not know where it's leading to. And you can still call us at the Alzheimer's Association. We talk to everyone who has any kind of memory issue like that, but especially dementia and Alzheimer's disease. Here's our helpline on the screen. And if you're on the phone, I don't know if there's anybody on the phone, I can just read the number to you. It's 800-272-3900. And that's a 24/7 helpline that you can call and get assistance. And it's not that somebody will come to your house and come assist you with your caregiving, but answer questions for you, help you figure out resources. Maybe you have a question about a drug, maybe a drug interaction. You're caring for a loved one and they've taken this new drug, they've got Alzheimer's, and this new drug has made things 10 times worse. You can call our helpline and ask, what do you think I should do? And this is the name of the drug, and what do you know about it? And we have people on the other line who are social workers who are trained in these types of questioning. And sometimes it could be a crisis. You could be having a crisis with your loved one, and they're trained to deal with that as well. Also on this screen is our website, alz.org. I hope you'll go to it at some point when you have some time. It's a huge website. It's got a lot of information on it, but it is definitely helpful if you take your time and go through it, looking at whatever resources you might need. Maybe you want to learn more about health, or you want to learn more about Alzheimer's disease like we did today, or you want to learn more about caregiving or caregiver stress. We have a lot of different topics on this website that can be of help to people. And also just encourage people to become a volunteer. We have millions of ways to volunteer for the Alzheimer's Association. We have people who, and I saw a name on our attendance list here, our participants that I don't know if it's one of our volunteers for the Alzheimer's Association, but we did have a volunteer through CCACC in the past. And it's a great way to help with this cause, especially if it affects you personally or your family members. But you can also just join one of our walks to raise money. It's a great way to support the Alzheimer's Association also. So I'm going to go ahead and stop sharing. And I'm happy to answer any questions or anything that people are wondering about.
Definitely. So Alzheimer is it's a condition that you never think of before you get hit. So that's my experience. I do join the walk before pandemic. So it was very powerful, really having people around you who really passionate about the condition. So we do have a question from the chat. Thank you so much putting the question in. Grace asked, any recommendation on tracking device that we can use for dementia patient in case they couldn't find their way home? This is a very, very devastating situation.
It's a common, very there are some hallmark, we call them things that are, even though we say this disease, it affects me one way, we could be diagnosed the same day, but you're going to have a different experience than I, and we have a lot of things in common, but a lot of different things. The thing in common is getting lost. And that's a big indicator that something's really wrong too, is that if we have a loved one that, they seem okay, but their memory has been kind of strange lately. But, during the pandemic, whose memory hasn't been strange, or who hasn't had some, maybe kind of strange incidents even to get lost. But it's when you add all of these things up that it's a little bit more than that. So I think, maybe the question is really about somebody who, we know they have a diagnosis, or they know something definitely is going on. Because for a long time you wonder, in the early stages of Alzheimer's disease, or if you just have dementia, or even if you've seen a doctor and they say, oh, you have mild cognitive impairment, MCI. Well, what is that? By the way, you can call our helpline and ask, what is MCI? Why did my doctor tell me I have this? And we will talk to you about it. It's the beginnings of a problem, basically, with your memory. And but getting to the question, so we know our loved one probably has one of these diagnoses. We don't want them to get lost. Maybe they have gotten lost. And there are a lot of things on the market right now. I mean, I've heard of people who first use cell phones. Everybody has their cell phone. Hopefully your loved one doesn't lose it, because that's what they do too, is they lose their cell phone. But of course, we know we can track them on that first. And I've heard a lot of caregivers talk about their loved one who is experiencing, memory issues and maybe dementia, using their phone all the time to get home. They have to use their navigation, first of all, because they get lost a lot. They can't get home on their own. But then eventually they forget how to use that even. So obviously the phone is the easiest thing. If they still hold on to it and have it, you can track them through that. They have a product called Tile. I don't know if you've heard of it, Tile. And it's a small, looks like a Scrabble tile almost, electronic. And you can put it in their pocket or in their purse or backpack maybe, and they might not know they have it. And it almost works like the, I've heard of recently on the news, the Apple AirTags that people put on that. It works like that. The AirTags are bigger. These are smaller, and you can slip it in a loved one's pocket in the morning and track them that way with the software, for sure. They have, medical alert bracelets, Wander bracelets. Some of them are electronic. Caregivers, I talk to a lot of caregivers, and I wish I could say, oh, this is the best product that I've heard of, because it's so different for each person who has this disease, because caregivers say, oh, they lose the watch. Oh, they lost the phone. Oh, then they found the tile and they, you know, that was gone too. And it's hard to say. On our website, we have an actual part of the website that is shop, ALZ, Alzheimer's Association. And it has a lot of products on there that you can look. We don't recommend anything. We say, yeah, you should protect your loved one. Definitely look into a system. I talk to a lot of caregivers when they think somebody's going to wander. So this is different than getting lost. Getting lost is like they went to the store and they thought they could do it, and then they get really lost. They get on the Beltway and they never get off, or you know, something. They go on 270, they go all the way to Frederick, and they're lost. Wandering is a little different sometimes, where you're in the home. The person maybe says all of a sudden they don't recognize their surroundings. This is not where I live. I'm going home. And they get out the door and go, and maybe either wander on foot or by car. So either way, if you're experiencing or you think you see this in the future with your loved one, or it's happening right now, I hope you please do research some of these products. But there's a lot of them out there. And I can't say I recommend one over the other. I think you really need to look into what's best for your loved one. So, and it could be anything, like even an Apple AirTag, you know, is a good way to track people and things also.
Yes, I'll let you know. I'm about to order an Apple AirTag. I spent half an hour trying to find my car key to get to work this morning.
Well, that's what it's good for.
So I'll let you know.
For us, yeah.
I'll let you know how it works. But someone asked a question. I think it's a great question. Is there any tool that really connect to the local police station? I think I heard it somewhere. Actually, the sheriff office have some product like that, but I would leave it to.
You know, maybe that'd be an interesting thing to find out if there is. The only thing we talk about, and I actually do a training for first responders here in Montgomery County. I should say I'm the local person for the Alzheimer's Association. I'm right here too in Montgomery County, and I do a training for them. So for them to recognize, what is Alzheimer's disease? Does this person have Alzheimer's disease, or are they on drugs, or is there something else wrong with them? And so in that training, we talk about, it's called Medic Alert. And you probably have heard of it. It's just a bracelet. It's not electronic. It's a bracelet. It says Alzheimer's Association, I have Alzheimer's disease. And on the back of it is a registration number. So that is a direct connect. If a police officer finds somebody who's wearing this bracelet and maybe is lost or disoriented, they can call the 800 number for Medic Alert, as well as sometimes the family knows the person's missing, so they've reported it, and so we'll go ahead and connect the dots that way. But it's hard, you know. You have maybe an hour, 2 hours where you don't know where your loved one is, and it can be excruciating. So the Medic Alert is a good way, and I think it's good local. But I've heard of people, you know, wandering. They live in Florida now, and they decide they're going home to Maryland, and they haven't lived in Maryland for 10 years, but they get in the car. There's a gentleman who did this and drove all the way, and he ran out of gas. That's what stopped him finally, just ran out of gas. Yeah. So
Wow.
And then when you get up here and you've been reported missing in Florida, it's hard to connect the dots that way. But locally, I think they do connect them here.
Yes. Along the way, we certainly will do more research and see where are the resource. And this is a very really urgent needs.
Yeah.
I remember those stories in the early stage.
Yeah.
So is there any official diagnosis that a doctor can make? Any medical, on the medical side? Yeah.
Now it's really progressed a lot. It used to be that probably we all heard this, that you couldn't even tell somebody had Alzheimer's disease, or even know what was the difference between dementia and Alzheimer's disease. In the past, you had to wait for the person to pass away and then find out on autopsy by looking at their brain. So of course, things have really progressed. And as far as dementia goes, a lot of people get diagnosed with dementia, and it is It could be a symptom of something, but there's also, if you remember, under that umbrella of dementia, there was vascular dementia, which is a specific type of dementia, Lewy body dementia, even with diseases like, I don't think it was under the umbrella, but Parkinson's. Now, Parkinson's is a totally different disease, but it has dementia as a symptom sometimes. So it's really, you know, a difficult diagnosis, but yes, you can get diagnosed with dementia, and then it could be that the diagnosis progresses then to Alzheimer's disease. And sometimes it starts with what I said earlier, the mild cognitive impairment. You go to the doctor, maybe they refer you to a neurologist, and they say, I think you have mild cognitive impairment. And well, what is that? And so that's kind of the beginnings of something's wrong. It might be dementia. Maybe you're developing dementia, which is a bigger symptom, which is the real problem with the short-term memory. You know, can't forget, I can't remember where my keys are, don't know the names of my grandkids, get lost easily, you know, in driving my car. That's becoming real dementia, and then could lead to Alzheimer's disease.
Yes. So unfortunately, there's no one test, one diagnosis can tell you it's mostly the symptom oriented, and use medical to rule out other physical deficit.
Yes, and you know, sometimes you could have somebody who is having, I mean, this is a good case scenario, somebody who has what seems like dementia, and but they were fine, you know, maybe 2 months ago or 6 months ago. Is it a quick, did they quickly develop this? And I've heard of, I've seen too, drug interactions that happen that give you dementia symptoms, like maybe problems with your memory, problems with your thinking, maybe you have an infection. I don't know if you've ever heard of somebody with a UTI that goes undiagnosed and untreated, and could really mimic some symptoms of dementia also. So thank goodness those can be reversed mostly with treatment, but it's hard to know. But we always say at the Alzheimer's Association, if you think something is wrong, and just because you don't know what it is, well, go find out what it is. You get to your doctor, get to a clinic, get somewhere to start on the path of, and a lot of people can even go to, this is a simple thing, you see it a lot in our community, is a memory screening, it's called. It's just a simple memory screening that it's a little test. You can even get it in your doctor's office. A doctor or a nurse can do this. It can be as simple as maybe we have an annual exam, and you're going to take my blood pressure, you're going to measure my weight and all the things we do, and you might ask me to remember these 5 objects: chair, apple, water bottle, and lamp. And then we go through the whole 45 minutes maybe, and then at the end you say, okay, Sheila, what were those 5 objects? And hopefully I can remember chair, apple, water bottle, and lamp, I think it was. So and that's a simple memory screen, simple. And maybe if you can't get those, well then, okay, that could be something, and let's check it out. So
I think it's mostly family or people around that person notice, right? After a few times. I remember my sister said, wow, I've been having the same dish for 6 months every single day. See, it's just one of the signal. But anyway, we will share that in our workshop. I'm sure we have a lot to share. So someone asked Xiaoying, do we start 2:30 next Thursday, or do we start at 3?
Yes, I will talk about more about workshop the coming after we answer all the questions.
Okay.
Yes.
And Jenny shared very useful information. I just remember a long time ago, I remember Montgomery County Police Office, they provide resource, but unluckily, Jenny said they stopped that. So instead they tell her to buy road ID bracelet.
that's a good one too. Yeah, that I'm glad she put that in there. So if you want to Google that, road ID bracelet is another one. Yeah.
Yeah.
And it's funny, and I think the other system was also tied to Medic Alert, which is now things are going much more electronic, you know, rather than wear a bracelet and wait till you find the person. Well, we need to go out, be looking for them. And we're kind of more of an electronic generation now at this point. So, yeah.
Yes. So another medical question, any type of medical imaging that can help validate, right, to just prove that diagnosis?
All sorts, yes. So it can be anything from any kind of PET scan or imaging that way. Some people ask, well, how do you get all that done? And what do you do about that? And I say, start small. If you think you have a problem and you hit the nail on the head, it's not usually me that thinks I have the problem. You are my spouse or my neighbor or my good friend. You're like, something's been up with you lately. And I always say to people, please listen to your family and your friends and your neighbors. Listen to what they have to say. So what do you do about it? And the first thing you can do, if you're Medicare eligible, if you're 65 and older, and maybe you can even do it at the health centers at CCACC, is get a Medicare wellness visit, which is once a year if you're enrolled in Medicare. And many people don't even know that that's what's happening. They're going for an annual. It's a free visit. It's Medicare wellness. They're going to ask you all the usual questions, but not every doctor or nurse asks you about your memory. But you as the patient can say, hey, my wife or my husband keeps telling me my memory is not so good. What can I do about it? And they can start a process from there. And it could be that memory screening, simple tests, could be referral to a neurologist, could be some of these brain imaging tests. It's a lot of it depends on what symptoms you have, what your, this memory testing is really good. And they are going to know, especially when you don't just take one test, a neurologist hopefully will follow you and see in 6 months or a year, take it again, take another one, and then see if you're progressing the way either Alzheimer's disease patients do, or maybe it's vascular dementia, or how is it progressing? So please ask for, if you think you're having memory problems, please tell your doctor and ask for help.
Okay, so I thank you so much, Sheila. This is really super helpful, and a lot of the information. I think this is just one of the million talks Alzheimer's Association offer, right? Do check out the website. They're very powerful. They are in the leading place in terms of research on this condition. So it's a lot of information in that. Please check that out.
And you know what I failed to mention earlier, just very quickly on our website, you can go ahead and change it to any language you'd like, whatever is easiest for you. So I think, and also if you call our helpline, we have help in like 100 different languages. So we really try to, it might take a little longer getting that right person, but we do try to help in many different languages. Certainly Mandarin is one of the top 3. So especially for our area here.
Yes, and I remember on the website, they do have some nursing facilities or memory care facilities. So that answer one of the question in the chat box, is there any language help in terms of the memory care facility? So do check out the website. I remember I just put in the zip code and I was able to find out some facilities.
Yes, that we have that kind of like a search engine like that. It's called our Community Resource Finder. I just put my email in there too. As I said, I think earlier, I'm your local person. So when you call that 800 number, if you say, I really want to know more about the local memory care facilities in my zip code, or I really want to know about the adult day programs, especially I get a lot of questions of, are the programs open yet? Who's open? Who's not open? What's happening? Who's virtual? So I try to keep, and I learned so much today about your organization. So it's great for me when I get a question. I don't make a big recommendation, but I say, I know all about them. What do you want to know? Yes. I can tell them. So it's much better to hear when somebody's experienced it, rather than me just being their Google search for them. I like to be able to tell them something.
Wonderful. Okay, so we don't run way over, and then we need to respect Sheila's time too. So for sure, we will invite Sheila back for other topics. So thank you so much. And like I said, this is just one tips of all the things that we need to know. We'll keep in touch and learn more.
Okay.
Thank you so
Thank
much. This
you.
was wonderful. Thank you, everyone. Have a great weekend.
Thank you. Thanks, Sheila. So, okay, so now I will start recording.